Can eligible veterans use both TRICARE and VA healthcare? Imagine having to health care options at your fingertips and wondering if you can use both for different needs. That's a common question among veterans and service members. Let's break down how these programs work together. First, TRICARE is the Department of Defense Health Care Program. It covers active duty service members, retirees, and their families. It offers a wide range of services, from doctor visits to hospital stays, and is managed through military health systems. Eligibility depends on your status, and you need to be registered in the Defense Enrollment Eligibility Reporting System, or DEERS, to qualify. The Department of Veterans Affairs manages VA healthcare. It provides extensive care to veterans who meet certain criteria, like length of service, discharge status, or having service-connected disabilities. To get VA healthcare, you apply at VA facilities or online. Your eligibility depends on your service record and health needs. Now, many veterans can qualify for both programs at the same time. For example, a retired service member under age 65 might use VA healthcare for service-related issues and TRICARE for other medical needs. You can choose which program to use for each visit or treatment. But it's important to know that TRICARE will not pay twice for the same care. If the VA covers a service, TRICARE won't pay for it again. VA facilities are also part of the TRICARE network on a space-available basis. That means TRICARE beneficiaries can sometimes get care at VA clinics if there's room, without affecting the priority of VA patients. This helps veterans get the care they need without confusion. For those transitioning from active duty, especially with service-connected disabilities, overlapping eligibility is common. The VA and TRICARE coordinate to help veterans understand their options. Benefit counselors at military hospitals or VA centers can guide you through this process. If you are a retired service member under 65, you likely have access to both programs. Make sure your DEERS registration is current and apply for VA benefits soon after discharge. Use VA facilities for specialized or service-related care, and TRICARE for broader or family health needs. By understanding how these programs work together, you can get the most out of your benefits. It helps you access quality care while managing costs. Always check with your local TRICARE office or VA representative for personalized advice. This way, you can make informed choices that suit your health needs and maximize your benefits.